Hey everyone, let's talk about antiemetics. So, antiemetics are drugs that treat and or prevent nausea and vomiting. So, there's a few causes for nausea and vomiting for those of us unfortunate enough to have experienced it. They can be anything from food or drug reactions and allergies. Drugs might have nausea as a common side effect as well, especially anti-cancer or oncological drugs. For this reason, a lot of times if a patient is undergoing chemotherapy or anti-cancer therapy, radiation, or even just has cancer and it maybe affects their ability to keep food down, we pre-treat them with antiemetics. Nausea and vomiting can also be caused by microbiological infections or diseases. Motion sickness, super common, especially it's fall right now when I'm recording this. So we've got our county fairs and these poor people are going on the tilt-a-whirls. They could really use an antiemetic. Pregnancy is also a very common cause for nausea and vomiting. You've heard of morning sickness, I'm sure, as well as anxiety, exhaustion, or other stressors. Some people just have digestive issues, GI issues, if they're super anxious or very, very exhausted. You might see people throw up after running a marathon, that kind of thing. Now, dehydration and electrolyte imbalance are a major concern with prolonged vomiting as well, which makes sense, right? Because you're expelling a lot of fluid, and that's going to throw off the salts in your body, the stomach acid, and it may have potentially some issues in terms of your electrolytes, so your sodium, your potassium, what have you. Now, antiemetic drugs are often co-prescribed with other drugs that are known to cause nausea and vomiting, like I said, with the oncological medications, and many are also available as IV or suppositories. So it makes sense, right? They would be intravenous or suppositories because if you're not able to keep food down, or if you keep vomiting or you have nausea, you're not going to want to swallow anything. So it's very, very good that a lot of these are available either intravenously through an injection or as suppositories or through other more non-invasive routes. Now, examples of antiemetics, we have ondansetron, which is probably the most common one that you'll see. Now, ondansetron or Zofran are tablets, which are orally disintegrating tablets, or ODTs for short. And they also come in IVs. Ondansetron is very, very popular, especially in the emergency room, or not emergency rooms, post-op rooms. So after someone's had an operation, they might give them ondansetron after surgery to prevent them from too much nausea from the anesthetic. Very commonly used in IV for post-operative nausea, vomiting, and side effects of ondansetron are often headache, fatigue, and dizziness, as well as constipation. So, I mean, it's not the worst side effects when you consider the alternative, right? The other class of antiemetics that we have to worry about are dopamine antagonists. So they work in the brain to block the stimulation of the chemoreceptor trigger zone, or CTZ, and vomiting center. These things sound much more complicated than they actually are. Basically, they're just parts of the brain that trigger either nausea or a vomiting response based on external stimuli. So you'll see that chemoreceptor trigger zone, that CTZ, that triggers nausea and vomiting in response to drugs and toxins. And then the vomiting center, some people vomit if they smell a bad odor, smell, or a taste, and that gets triggered in the brain, goes down to the diaphragm, into the stomach, that sends a signal down there, causes a vomiting or nauseous response. Now, the thing to worry about with dopamine antagonists, because they work in the brain, they can have some psych side effects. So they can cause sedation, they can lower the seizure threshold, which is quite dangerous in people with a risk of seizure disorder. So I would pick ondansetron before I picked any of these other drugs for a person with maybe epilepsy or a history of seizures. And one, especially metoclopramide, this guy right here, Reglan, also carries a risk of movement disorders. That's related to dopamine in the brain. If you have a imbalance of dopamine in the brain, it can sometimes cause people to have tics or other sort of, it's called like dyskinesia, like different movements. And so another very common medication which causes that are antipsychotics. So you would not want to prescribe a dopamine antagonist if someone is also taking antipsychotic medication. Now, your examples of dopamine antagonists are metoclopramide, which is Reglan, I will say, as a side note, metoclopramide is the worst drug ever, and I'll tell you why. So not only does it have the risk for movement disorders, EPS, it also is the only drug that I am personally allergic to. I had it post-op when I was a little kid, and I had a hernia, and not only did it give me a rash, but it also made me vomit. So it did the exact opposite of what it was supposed to be doing. So that traumatized little 7-year-old Dominic, and hopefully now you'll remember that Reglan not only has a risk of hypersensitivity reaction, especially when it's given IV, but it is a possible medication allergy as well. We also have prochlorperazine or compazine and promethazine and phenergen. They all work in very, very similar ways, but I would say ondansetron's probably the way to go. But I'm not biased. All right, that was a quick lecture. If you have any questions, feel free to email me. Thank you.